Moss, and I would like to welcome you to another edition of Moss Minutes. And what I want to do in this edition is something I guess that a lot of people do at this time of year, being the end of one year and beginning of another, is reflect a bit. And I do want to reflect, but I want to take it to another level, because this is not just the end of another year for Moss Nutrition, but as we enter 2011, this is the beginning of our 20th year. And a question I want to ask that kind of reflects is one that we have asked, and some people are still asking, who exactly is Moss Nutrition? What exactly do we represent? Now, why do I ask that? Well, lately I've been getting some comments. I'm not laying blame, but some interesting comments that people are just thinking that we're just another company. We're just another company that sells supplements. We're just another pretty website. And the inference, which is, I think, maybe a bit deserved based on what we see in much of the industry, is that who do we sell to? Well, when we qualify accounts, the only qualification we have is that they have a pulse. If they're alive and kicking, we'll sell them anything they'll buy. As much as they will buy, we'll sell it. Well, and I understand that based on the rest of the industry, but I can assure you that's not who we are. We've never been that. We are not that now, and we never will be that. So, who are we? Well, I want to divide this answer into three basic areas. Number one is an issue of safety. You know, like I said, there's a perception that it doesn't matter who we sell to. There's a very interesting editorial. This appeared in the Los Angeles Times. This is December 12, 2010. And by Karen Stabiner, and she said, supplements are only the first of three categories in which marketing or desire seems to outstrip verifiable proof. Again, the idea that all these changes, and this editorial is in response actually to all of the controversy we've seen with vitamin D. Piece we did with Dr. David Brady, which you'll see on our website, talked about this controversy and some of the literature that's coming out. And the suggestion is, well, this is all just a matter of marketing. This is like fashion. We're changing skirt levels basically to stimulate sales. And I certainly understand that. That's not who we are. So again, we are concerned, number one, about safety. Is it safe for you and your patients? There are certainly a lot of studies out there that suggest that supplements are safe and effective. But there are also other studies out there, and I have a lot of those other studies in my library, but there's other studies that suggest there may be an issue of safety. For example, there's a study that just came out December 13th. This is the Canadian Medical Association Journal that talked about the risks of taking excessive folic acid. In Canada, as the United States, much of the flour supply is fortified with folic acid, and they suggest that folate deficiency is virtually non-existent in Canada, and that taking excessive amounts may cause problems. We're very committed to telling you about the positive studies. I have a lot of them. We are equally committed to telling you about studies like this. We can't always say this on our website. It isn't always obvious. So we ask you, give us a call. Give us a chance. Give us the time. We will help you. We will tell you all the studies so that you get what is safe for you and your patients. What's the second issue? The second issue, of course, is efficacy. Now, this is a big issue and an ongoing discussion. An editorial that appeared in the Sunday, this is December 12th edition of the New York Times, on healthcare and the deficit. Talk about fixing the system. The best way to lower healthcare spending is to reform the dysfunctional healthcare system whose costs seem unrelated to the quality of care delivered. The reform law makes a good start sponsoring research to determine which treatments are effective and which are not. We are committed to making sure that we can find out, if you'll give us the chance, give us a time, give us a call, what is best, what will work best for you and your patients. It's not always obvious on our website. What's the other thing? The issue, and it's somewhat related, is the issue of cost effectiveness. We're not unaware of what's going on in this country in terms of the economy. And it is related to efficacy. We want things that work, we want things that are safe, but we want to make sure that you and your patients get the most cost-effective supplements that assure that. And you may say, well, It doesn't matter if it's a low-cost item. Who cares? We care. We care a lot. If the item is not safe and cost-effective, 1 penny is too much to spend. So we're concerned about all of these. And like I said, it doesn't always show up on our website. So when it comes to these issues, we would request that you give us a call. Give us a chance. Give us the time, and we will show you that we are not like all those companies that basically it seems like all you need is a pulse to get sold to. We want to make sure that you get the right product at the best possible price. Doesn't always show up on our website, but the people here is what truly define Moss Nutrition and make the difference. And I can assure you that everybody shares the concepts and the principles that have always represented Moss Nutrition, have always defined us now, and will define us in the future. I thank you very much for viewing. I wish you a very safe and happy end of the year, holiday season, and New Year, and I look forward to talking to you on the next edition.